Awesome. So with us right now is chiropractor Dr. Sasha Blaskovich. Dr. Blaskovich, thanks so much for joining us.
Thanks for having me. Appreciate it.
Perfect, perfect. Dr. Blaskovich, could you tell us a little bit about yourself? Give yourself a quick 30-second intro.
Yeah, chiropractor by profession. I don't conventionally act as a chiropractor. I have the training, and I've morphed my practice or my the and focus on the upper part of the neck, but mainly from the of uh, whether or not my patients have sustained permanent ligament injury, rendering that region of their spine unstable. And if that region of the spine is unstable or moving too much, then the likelihood that that part of their spine could be causing compressive forces on their brainstem, resulting in a whole gamut of possible neurological symptoms that has been generally overlooked and missed by the vast majority of the healthcare professions. So that's kind of what I focused on. The reason I focus on that is that's something that's near and dear to me because of injuries that I sustained 28 roughly years ago that have lingered with me ever since then, and so it's become a passion and so that's basically how I practice as a chiropractor. And the platform that I've created for that has been such that people from all over the world who have been misdiagnosed or not diagnosed properly, or maybe are walking around thinking that they've got and are not getting any better, any improvement, end up finding me somehow, and we can hopefully, in most cases, determine what is possibly the cause of the symptoms that they continue to have.
Hmm. Yeah, absolutely. And your work has stretched across the nation here in Canada and then internationally as well. You're a chiropractor by trade, and you've had a successful career treating over 1,000 patients, whether that be helping them recover from chronic pain in the neck, the lower head, from whiplash or post-concussion symptoms. You've treated patients following car accidents, car injuries, amateur athletes, pro athletes across CFL, NFL, and NHL. Um, what does I guess, kind of starting with the initial consult, what does that look like when you're working with these patients? They're often probably dealing with this chronic pain. They're assuming it's a concussion. They're assuming it's consistent headaches. What does kind of the initial consult look like when you're working with these individuals?
Most crucial thing is going through a detailed history of their symptoms, a detailed history of if it is an injury, which of how the injury happened, and a lot of them are surprised at the detailed questioning that is required to hone in on what I would suspect could have been injured. The big simple example is that most of the individuals that come to see me, whether they be people that have been in an automobile collision or they're some encounter in the sport that they're playing, is that they very rarely concentrate on the details, such as, my head was rotated to was hit from the left side, partially in the back. So in order for me to basically hone in on biomechanically what I would suspect the tissue or the group of tissues that would have been put to the test as far as resisting those forces, to be able to then go and perform diagnostic imaging and orthopedic and neurologic testing to confirm that suspicion. That's basically the nuts and bolts of basically try to find the cause, which is the exact biomechanical cascade of events. So the vectors, which direction things came from, and at what speed, and what was the position of the individual at the time of being impacted. And then does that correlate to the neurologic and pain symptoms that they're having? And then trying to basically diagnostically image them to confirm that in an attempt to then hone in on the exact tissue that would have been injured so that proper care can get initiated. A simple example is a lot of people who've been concussed or have been diagnosed with a concussion, their upper neck is omitted from the examination process. And so they end up doing vestibular therapy, which there's no shortage of vestibular therapists. But unfortunately, these patients, when they get the vestibular therapy, it tends to flare them up. And the reason it tends to flare them up and not actually improve any of their, for example, dizzy symptoms or nausea symptoms, is that there's nothing wrong with their vestibular system. There's something wrong with their upper or lower cranial nerves, I should say, in the lower part of the brainstem coming off of the medulla oblongata, because that's where they've sustained permanent ligament injuries to their C1, C2, or their upper two cervical vertebrae, which then forces them to actually press up against the brainstem on a repeated basis, rendering these neurological symptoms that are being diagnosed or seen as concussive like.
Mm-hmm.
So
Yeah.
that the key is to get a really, really detailed history of the event and the positioning of all the different players in that event, and then to determine, confirmatory by orthopedic and neurologic tests, does that jive? And also by diagnostic imaging, can you actually see things that would confirm that? And dynamic or stress imaging is by far the best way to determine this, because you can't look at something in neutral and determine whether it's functionally abnormal.
Mm-hmm.
And
Gotcha.
that's unfortunately the biggest shortcoming in all of medicine, is that the spine is dynamic, but yet is imaged statically. And
Yeah.
so the push that I have in my clinical practice is doing as much as possible stress imaging. So conventional imaging like X-ray or CT or MRI should be done at all costs upright and in dynamic positions. So at end range, bending back, rotating, and then do the imaging. And what I do in my own office is actually dynamic imaging that is real-time video X-ray of a person's neck moving around. And then you can actually look literally inside their neck and see if the bones are moving too much. And if they are moving too much, that would explain how in different positions and at different times they could elicit different neurological symptoms that are for them debilitating or impairing somehow.
Wow. Wow. So you're taking it beyond like traditional medicine, traditional examinations, and really building a prescribed approach to that examination. That's really cool to see because myself, I've dealt with neck injuries. I've had concussions previously, and it seems despite your best efforts, you could be working on a concussion or neck injury related symptoms for months with little progress and actually
Yeah.
working towards relieving those symptoms, seeing different professionals, whether that's a traditional doctor or someone who has some work within the concussion space, the neck injury space. It can be super difficult to actually identify the problem and then provide the correct solution and the steps to resolving that issue.
Yeah, I'm an advocate of forensic analysis. I think, crime scene investigation related matters. So you have to dissect all of the available evidence and information before you can actually implement a treatment plan. And I think far too often, the treatment plan is initiated just based off of symptoms and where the pain is, and very little focus is put on the neurological deficits that the person might be having. And that sometimes is actually also on the onus of the patient themselves, because they're not very forthwith in disclosing that, they have heart palpitations, temperature control issues, blurry vision, ringing in their ears, fullness in their ears, jaw clicking, urinary issues, digestive issues, stomach acid reflux. So all these things that they think are related to something else after they've had an injury, they don't disclose to the doctors, and the doctors generally, unfortunately, don't ask those questions because they're not trained to do so. They're trained to find out what it is, and then what have they got in their toolkit for addressing the pain, whether it's pharmaceutical medications, whether it's stretching, exercise, rehab, steam and cream. There's so many things that they'll throw at it treatment wise before actually honing in on the exact tissue that has been injured. And that's unfortunately a training mishap, as opposed to that the doctors don't have the capacity to do that. There's so much geared around treatment, and it's not enough geared around diagnostics, that it ends up shortchanging the patients who are living with these things, because all sorts of treatment thrown at them. And when all that treatment potentially fails, then the system makes a full circle back and says, okay, well, let's do some imaging, or let's do some specialized imaging to determine, what, if anything, we missed because the treatment didn't work.
Yeah.
And I'm a big advocate of reversing that, and throwing the diagnostic book at an individual. And then that would then provide cost savings in the treatment that gets implemented, because you're not trying stuff to see what sticks. You're actually doing something that hopefully should be very directed and very specific based off of what you found to be wrong.
Yeah, absolutely. Absolutely. And to prevent this kind of continuous cycle where you're treating possibly the wrong issue, you're getting the wrong medical imaging, you're providing the wrong solution for namely the wrong problem. And you see this across the healthcare system, whether it's you're working with like a doctor or coach on a team, maybe a parent or like teammates. All these individuals probably don't have the right toolkit, the right advisory options available to them to kind of help you through the solution, help you through this problem, and find a solution. For someone who's maybe been in a recent car accident, had a football injury or sports related injury, what sort of recommendations would you have for them for finding the right individual for helping them solve that problem, and then the next steps for actually solving that problem? What recommendations would you have?
Well, this is going to sound biased, but I do believe chiropractors are probably, if not some of the best trained biomechanists out there in the healthcare profession. And I
Mhm.
guess next to that would be kinesiologists, because we are very strongly, like the educational prowess of our curriculum is very strongly dictated by biomechanics, how the different components work and how they work in relation to each other. So I think, for starting points, as mainstream medical doctors are the entry point for most things for most people, and that's based off of what we've become used to because our parents did it and our grandparents did it.
Yeah.
We think we need to go that way. Chiropractors, pretty much anywhere in the world, are first line of defense, so people can choose to go there without a medical doctor's referral. So they don't need the consensus of a medical doctor to go see a chiropractor. And I think seeking out a chiropractor in one's local geographic region who either by word of mouth or has shown to be diagnostically and biomechanically oriented and not just treatment oriented would be the best starting point. Alternatively, for anybody who might watch this, even just reaching out to me from whatever geographic region they're in, and me seeing if I know of anybody or can find anybody in their local locale that might fit for me to basically point them towards and then see what happens, be the best bet. But as far as you'll see if procedures are performed, such as in-depth orthopedic and neurologic tests inside the office of whoever that practitioner is, if they just get you to bend your head forward and back and feel your neck muscles and tell you what they think, I think that's not sufficient. I think there's a orthopedic test that can be performed on the neck and head to determine what, if anything, has been compressed or to determine what the next course of events is, whether that's regular X-ray or an MRI or a CT scan or even motion X-ray. And unfortunately, motion X-ray, which I perform in office, there's only 2 in Canada, and so people can either go to Ontario or to British Columbia for this. But that by far is the best diagnostic procedure if there is a suspicion of ligament damage in the neck that's causing all these symptoms. But I
Mhm.
think for most people, somebody who's biomechanically inclined, which, like I said, will generally be your chiropractors and kinesiologists. And chiropractors are doctors. And so that might be the best starting point for anybody looking, because as much as kinesiologists have the high training, they're not seen as doctors in the system. So they're very valuable from my standpoint. But if a person is going to try to get referred somewhere after they're going to evaluate it, it would be easier to run that through a chiropractor than someone who's not designated as a doctor, and not to take away from what they are and what they know and what they do. But at the same time, you're working within a hierarchy system that um, caters to doctors.
Mhm. Yeah, absolutely. And for anyone listening out there, we're located in Canada, so our medical system might be slightly different from where you are currently located. But again, like Dr. Sasha Blaskovich mentioned, if you're dealing with an injury, um, feel free to reach out to him, and I'll be sure to link his contact information at the bottom of the show notes, just to make sure if you find yourself in such a situation, um, we can work to find the proper treatment for you. And Dr. Blaskovich, you sound to be so committed, first to understanding the full spectrum of the head and neck injury, whether that be the medical imaging, the research you've done on your own time, and then the proper procedures for moving forward to actually addressing the correct solution. Once you've kind of identified that specific problem, you're working on a solution to resolving that issue. What does success look like when you're working with a patient?
if the patient is a surgical patient, and those are pretty obvious when you see them, success to me looks looks as follows. I've been able to provide them several treatments to show that there can be an improvement,
Mhm.
and then secondarily empowering them to perform that same treatment on themselves so that they on any daily basis can divert to self-management where they're not dependent on someone like me or whoever they would be seeing for treatment. Assuming that they do have permanent ligament damage in their neck, there is no, at least not that I found, a stretch or magic anything that's going to permanently repair what has been damaged in that injury. And so it will require a daily regimen of things, and there's a variety of things, and I've listed most of those in the book that I published in 2021, that are basically things that I've discovered and my co-author Ethan had discovered for himself, that provided a better quality of life to him and to myself. And a lot of the things that we did overlapped, and some things that I did that he didn't do were helpful, and some things that he has done that I've never done are helpful as well. So people can draw upon all those experiences and trial those things, but the empowerment of managing this yourself to the best, dependent on a therapist or a doctor to provide you that relief, has been the biggest godsend, if I can call it that, to me. Because once I discovered this and started implementing it and put the power in my own hands, to mitigate my symptoms on a daily basis, it allowed me the freedom to be able to act and live on a somewhat normal capacity.
Hmm. Absolutely. And you mentioned your book. I'll share it briefly for the folks who are listening. It's called Dr. B's Concussion Breakthrough, exploring the hidden connection to neck injuries and a simple guide to naturally healing your brain. Could you speak to maybe a few highlights of the book? I don't know if there's maybe two or three takeaways that you could kind of share that just briefly highlight a couple things within the
Sure.
book.
Um, the the connection between the neck and the brain is what we've already talked about, is sort of permanent ligament damage to the upper neck. And when you have that permanent ligament damage, that means that the upper neck bones move more than they should. When they move more than they have the capacity to compress the lower part of the brainstem. And the lower part of the brainstem, as a simple example, one of the so-called cranial nerves, which are basically autonomic nerves that branches off of that lower part of the brainstem, is the vagus nerve. And the vagus nerve, if you just Google the functions of the vagus nerve, it's pretty much interconnected with every system in our body, from digestive to respiratory to cardiovascular to reproductive, to all those systems it's linked to. So people can have symptoms in any of those symptoms or any of those systems, pardon me, as a result of that brainstem compression. And so if a person is struggling with concussive like symptoms that are being labeled as such, and they have not had their upper neck evaluated for permanent ligament damage, that would be the biggest takeaway from the book, is to basically have one's upper neck assessed to see whether or not something there has been missed as far as damage that could be linked to what they're being told is concussive like, pardon me, that are concussive like problems or concussive like symptoms.
Wow.
That's the biggest takeaway. And there are multiple tips in there, from cold water submersion to breathing exercises to vitamin supplementation, to mindfulness, positive thinking, all these things that I used to sometimes think were wishy-washy. They all have a role in obtaining a better quality of life as a whole, even if you're not going through this type of problem. Those are the main takeaways: is have the upper neck evaluated functionally for permanent ligament damage, and implement a whole bunch of things that you possibly thought were wishy-washy, and therapy or for tree huggers or whatever, that are actually very useful. And I'm a redneck. Grew up in Calgary, and so these were things that were like, tough it up, cowboy. But they really have a lot of value, and I can say that now in retrospect, that I'm a firm believer in a lot of these things that, as a redneck, I would have thought, for sissies.
Yeah, absolutely. And having taken that holistic approach, regardless of what sort of treatment option you're doing, keeping an open mind and adopting that and at least trying it to see if it possibly works before moving
Yeah.
on. That's a great approach. And having a full wide array of toolkit of different things that you can exchange and pair out while you're trying to solve that problem provides a great kind of pathway to solving that issue. And you've been working as a chiropractor specializing in head and neck injuries for 20 years and treating over 1,000 patients from various walks of life. You've paired your professional skills with an entrepreneurial flair. How have you been able to achieve this level of success?
I don't know if I'd call it that, but it's a passion. Um, it's by necessity. So a couple of the tools that I've designed right now. So the main treatment modality that I use on myself and on my patients is simply boiled down to acupressure. So pressure on muscles in certain positions where you sustain that pressure for 20, 30 seconds, relieve a trigger point. And so I've designed an S-hook shaped tool called Dr. B's Trigger Pointer. That is a cheat tool to be able to do that pressure point therapy to yourself better and longer, which makes it then more effective. And right now we're also releasing Dr. B's neck stabilizer on the market, which is intended to basically be used in conjunction with the trigger pointer. So one would first release the muscles and reset the muscles in their upper neck, and then after that they would go into this neck stabilizer device, which is basically a aluminum contraption that goes on your wall that has a head harness and four elastic tubing things attached to it, that no matter where you go from your starting point, you have resistance. And so once you actually reset the neck muscles, then you can do this explosion training with the neck stabilizer. Not strength training, it's training the muscles to be more responsive and more quickly responsive. Because at the end of the day, when you have these injuries, it's not how strong your muscles are that are going to prevent re-aggravation. It's how quickly the muscles can respond to some kind of an unexpected stimulus that is going to protect your brainstem, basically. And so there, are several other things on the market that focus purely on strength. This thing that we've designed is intended to focus on explosive movements. So you're not going to go to full range with all the movements, but you're going to go to 50% of full range, but you're going to do it quickly and return. And because there's elastic resistance constantly engaged in the process, you're getting both concentric steppers in your muscles, which are then feeding back into your brainstem and brain and being coordinated that way, so that you technically, in a simple fashion, you train your fast twitch fibers to be faster, so that the average person's neck muscles can respond in 3/10 of a second to an unexpected stimulus. And this is why when you get in a car crash, if you're not expecting to hit, you're way worse off, which is contrary to what the mainstream would lead us to believe.
Oh,
But
really?
if you're guarding and you're protecting at that moment, yeah, you'll probably injure your muscles, but you'll protect. Not expecting it, because our muscles are hardwired to respond roughly in 3/10 of a second to an unexpected stimulus, and knowing that the peak acceleration of the unexpected stimulus usually happens at a 1/100th of a second, 1/10 of a second,
Hmm.
our muscles are 2/10 of a second too slow to respond to protect the ligaments from being injured. And that's why we sustain permanent ligament injuries when the someone gets blindsided in football, or someone gets rear-ended not expecting it. You sustain permanent ligament injuries because the muscles have not engaged or are too slow at engaging to protect the ligaments from ripping.
Wow.
And so with this explosion training, the goal is to basically, if you haven't ever had these injuries, to hardwire and train those fast twitch muscles that should protect your neck from having ligament injuries, to get to at least the 1/10 of a second response time, or even better, so that
Hmm.
if you do have an unexpected stimulus, they respond way faster, so that the ligaments don't get put at least as much as before, to the test and risk failure.
Wow. Wow.
And if you already have been injured, your likelihood of re-aggravation is high. So if you can get those fast twitch fibers to also get to the 1/10 of a second or better, any additional stimuli you'll have in the future that might re-aggravate you or re-injure you, so to speak, will be also minimized.
Wow. It's interesting you say that. I know we're kind of getting close to time here, but it's interesting that you say um, you're actually better off if you're bracing for impact as opposed to not bracing. That goes against conventional wisdom. You always hear you shouldn't brace for impact. You're better off if you don't brace. Wow, that's interesting to hear, and I would assume that's been proven.
That's a massive fallacy. So the
Yeah.
Mythbusters could probably break that one down.
Mythbusters episode. That's awesome. Well, excellent. This has been a remarkable conversation, Dr. Blaskovich. Again, you've helped thousands of patients recover and mitigate chronic pain from whiplash or post-concussion symptoms. Your work has stretched to serve car car crash accident survivors, amateur athletes, professional athletes, and for anyone who wants to learn more about Dr. Blaskovich or the work you're doing, they can find you online at Sasha Blaskovich on LinkedIn or at drblaskovich.com. And I'll be sure to add your links below just so people can find you online if they wish to do so. Again, Dr. Blaskovich, you've taken your own injury to your head and neck and turned it into a career solving related issues for others. Dr. Blaskovich, thanks so much for joining us.
Appreciate it. Thanks for having me. Thanks, Harrison.